everyone. It's Dr. Cynthia J. Hickman, your proactive caregiver advocate. Thanks for joining me today. We're going to talk about from nurse to caregiver to educator. I'm speaking from the heart. My nursing profession began in 1985. Now I am a nurse educator. I am so proud to be a professional nurse. It's my sacred profession. Passing the state boards on the first try helped me realize that I took my training and studies seriously. I vowed to use my knowledge and skills to be a rainbow in the lives of patients and families facing health challenges. As a nurse, there will always be unknowns, surprises, and innovations that we may or may not understand. But we have to take the good with the bad. My 2 cents is, while technology has improved our practice, it can also and has also made us lazy. I tell my students there are no shortcuts in nursing. We are responsible for people's lives. It can be challenging and rewarding, but it is what we signed up for. The flaws and imperfections of our profession will forever be there. It is up to us to take the bitter with the sweet and turn lemon into lemonades. Notice I did not say take abuse and discord. We are professional nurses, and while some things may try our last nerve, remaining professional and remembering why we became nurses should always be at the forefront. The laying on our hands is what we do best. When I was reading the morning news, I noticed so many nurses are leaving the profession. It hurt my heart. As you know, the pandemic has tried our minds, our bodies, and our spirit. It has taken us away from our families. It has taken our families, friends, colleagues, and a few of our enemies. But nurses are caregivers. One cannot remove that from reality. Caregiving is hard work. Nursing is hard work. As I read about this nursing shortage, I recall a nursing shortage being a conversation before, when there weren't enough educators to teach students who were in nursing schools. And now we realize that nurses on the front line are struggling since the pandemic. Acute hospitals, nursing homes, assisted living arrangements, group homes have faced unimaginable circumstances. But I pose the question, who has a crystal ball that alerts us to the dangerous destructions or global pandemic? And even if we had a crystal ball coming at us, as nurses and caregivers, we do not abandon the ship. We step in, fill in, and do what we can to help those in need. Please know I'm not debating the situation and circumstances around COVID-19 patients and their care. My anger and frustration is more about the misinformation and politicizing of how we determine that the pandemic and the way out happens. Nurses, doctors, and allied health professionals, they're weary. They're strained. I wonder, and I want you to wonder, who will take care of us if there's no hospital, no doctors, no nurses, no staff? The nursing shortage will always be a conversation, but now it's a conversation because of the pandemic, because of everything that's gone on. So we need to recognize that our staff, our professionals, our healthcare providers need us to do the right thing. While I experienced my personal anxieties and stress as my niece suffered and died from COVID-19 in July of this year, I cannot picture the nurse caring for her, throwing up her hands and walking out. We are facing tough times, no doubt, as healthcare professionals, as nurses, and as caregivers. In all that's going on around us, we must find our happy place. We must remember why we are nurses, why we are caregivers. I've experienced many outcomes that did not turn out the way I hoped. Losing a transplant patient or doing CPR on someone for an hour and the patient still dies, never meeting her newborn, was gut-wrenching. But that was my reality at the time, but I never felt the desire to throw up my hands and leave because of the consequence. Our society has forgotten we are our brother's keeper. We must do things to support each other, help each other, provide for each other, and care for each other. As your proactive caregiver advocate, while at the bedside of a patient, challenged by many situations, I never wanted to jump ship because it got tough. I did, however, protect my license, and I want you to do the same. There's a Nurse Advocacy Association that helps you understand the Nursing Safe Harbor Act. Please look it up. Take care, be well, and bye for now.